Acute lymphocytic leukemia is the most common leukemia of the childhood. This acute lymphocytic leukemia affects the lymphocytes, which are immature B or T lymphocytes in the bone marrow, that is the cells involved. The etiology of this is mainly genetic, chromosomal aberrations resulting in abnormal transcription factors in the bone marrow, resulting in abnormal proliferation of B and T lymphocytes. As you can see in the peripheral blood smear, there is rich amount of immature B or T lymphocytes. You can clearly see they are overcrowding, and normal RBCs, which are in millions, itself is not clearly visible. The morphology of the cell is condensed chromatin with scanty cytoplasm, and occasional small nucleoli is seen in this lymphocytic leukemia. Sudden onset of symptoms in the child related to bone marrow depression like anemia, there will be fatigability, tiredness, hypoxia, severe bone ache will be there for the patient. Also with frequent infections, because the normal WBCs will be not in adequate amount. Rarely petechial hemorrhages because of thrombocytopenia, but bone pain is so severe the patient requires admission in the hospital, and CNS manifestation is due to the bone which is compressing, especially the spinal cord. It will compress in acute lymphocytic leukemia. When you see the peripheral blood smear, more than 30% of the WBCs which are there in the peripheral blood smear are lymphoblast. Immature lymphocyte is called as lymphoblast, along with associated anemia, that is reduced RBC count, and thrombocytopenia, reduced platelet count. That is the CBC finding of the acute lymphocytic leukemia. Whereas chronic lymphocytic leukemia is a disease affecting male individuals, adults mainly, approximately 40 years or middle age. It affects the peripheral B and T lymphocytes, not in the bone marrow. It affects in the lymph nodes. This is a classical difference between ALL and CLL. ALL affects pediatrics, whereas CLL affects adults. That too, ALL affects bone marrow, therefore the child has got bone ache, whereas CLL affects lymph node, that is a peripherally placed B and T lymphocytes. The mutation of the genes or the chromosomes present in this peripherally placed B and T lymphocyte is the main cause for this CLL or chronic lymphocytic leukemia. Symptoms are mainly, majority of the patients are asymptomatic. They may have constitutional symptoms like fever, weight loss, lymphadenopathy, and classical hepatosplenomegaly, because all these are belonging to reticuloendothelial system, which will try to compensate the release of mature lymphocytes. So this patient with CLL will have lymphadenopathy with hepatosplenomegaly. When you see the peripheral blood smear count, obviously the lymphocytes which are mature, you can clearly see. See, in ALL it was immature lymphoblast in the peripheral blood smear, whereas in CLL, which you can see in the second lower picture, it's a mature lymphocytes, but they are more numerous. They are more than 20 to 30% of the peripheral blood smear. So lymphocytes counts are more in the peripheral blood smear. If you do a differential count, it is more than 5000 per microliter will be there. Platelet count is obviously low, RBC count also is low. So associated symptoms will be there. In CLL, constitutional symptoms affecting adults, mainly male are more common than female, 3:1. Chromosomal aberration in the peripherally placed T and B lymphocytes, especially in the lymph nodes. So they will have CLL. Moving on to myeloid leukemias, acute myeloid leukemia and chronic myeloid leukemia. Acute myeloid leukemia occurs in adult, again in the middle age. These myeloid series, they have classically, the myeloid series means those cells which give rise to the granulocytes, neutrophil, eosinophil, basophil. Their parent cell is called as myeloblast. So there will be OR rods in the cytoplasm of these myeloblast. OR rods are nothing but abnormal accumulation of lysosomes in the cytosol of these myeloblast cells. They can be just myeloblast or myelomonoblast or monoblast. Monoblast means which give rise to monocyte or macrophage. So this immature myeloid series, which has to remain in the bone marrow, now it has come into the peripheral blood smear of a patient. Oncogenic mutation, accumulation of genetic mutation due to chemical exposure like benzene and all can result in acute myeloid leukemia. This patient has got vague symptoms not due to leukemia, due to compression of the other bone marrow cells, that is erythroid series, resulting in anemia and anemic symptoms like fatigue, tiredness, hypoxia, lethargy, loss of appetite, and megakaryoblast in the bone marrow is prevented from growing. So minimal platelets will be there in the peripheral blood smear, therefore resulting in spontaneous bleeding, petechial hemorrhages, collection of blood underneath the skin resulting in trivial trauma, resulting in a blood clot under the skin called as ecchymosis. All these are vague symptoms in acute myeloid leukemia. Therefore, this patient will visit 10 to 20 doctors before actually coming to the hematopathologist, because the symptoms are really vague, because the symptoms are mainly due to accumulation of the myeloid series in the bone marrow, resulting in regression of the erythroid series, resulting in anemia and its symptoms, megakaryoblast series resulting in thrombocytopenia and its symptoms. So therefore diagnosis will be delayed, and once they are diagnosed, the peripheral blood smear shows more than 30% of the peripheral blood smears are myeloblast. How will you know it's myeloblast? Because they have R rods in the cytoplasm. Therefore we'll know it's acute myeloid leukemia. So that is classical. More than 30% of the cells, WBCs in the peripheral blood smear are myeloid series. Last but not the least, chronic myeloid leukemia. It is a classical translocation will be there in this, that is called Philadelphia chromosome. Translocation between chromosome number 9 and 22, between 9 and 22, that is BCR ABL genes. The BCR gene of 9 will translocate with ABL gene of 22. The classical translocation was first found in Philadelphia, therefore called as Philadelphia chromosome. It's a chronic myeloid leukemia. It's a disease of elderly. It's rarely in child, chronic myeloid leukemia. Also, tyrosine kinase pathway has been blamed. Here you can clearly see the myeloid series, which are, when compared to the AML, much mature neutrophil, eosinophils, basophils. We can see here darker staining nucleus we can see, that is pluripotent stem cell myeloid series. We can see the bone marrow finding are hypercellular bone marrow with elevated number of neutrophils, eosinophils, basophils, especially eosinophil and basophil is elevated. Mild symptoms will be there, mainly related to anemia and thrombocytopenia. Classical splenomegaly will be there. Splenomegaly is a classical finding of CML. It is not found in other cases. The isolated splenomegaly should give a suspicion of chronic myeloid leukemia. Though in chronic lymphocytic leukemia, in addition to lymphadenopathy, we have hepatosplenomegaly, but all organs are enlarged here. But in chronic myeloid leukemia, only splenomegaly will be there. So some patients find it benefit after splenectomy. They found it really beneficial. The peripheral blood smear shows WBCs increased more than 50,000 when they are asymptomatic, up to 2 lakh to 10 lakh, more than 2 lakh to 10 lakh during the symptomatic stage in chronic lymphocytic leukemia. And age group is nearly elderly, 50-60 years. It's also bimodal distribution. Younger age group also between 20 to 30 years. Again at 50 to 60 years it will come once again, chronic myeloid leukemia. Hope this helps. Thank you.